Morning, everybody. Bit of unwelcome news today. As you may know, our case numbers continue to rise and rather steeply. I'm sure Dr. Spitters will be walking us through some of the details on that, but again, unwelcome news. Pandemics are rather unpredictable, but one thing we do know is that COVID will make people sick and kill. It's still a deadly disease, and I've been heartened to see that treatment options seem to be lessening the death toll a little bit. But again, we're concerned with the spike in case numbers that at some point we overwhelm our ability to treat people. And so that could change, that situation could change. So right now in the US, every day, about 700 or more people are dying every day from COVID. And what that translates to is that every 3 days we're seeing more deaths than those who were lost when the Titanic sunk. And every 5 days we're losing more people than were lost on September 11th. So we should not take this lightly. This is a serious disease and a serious pandemic. We need to do whatever we can to keep ourselves and our families and neighbors safe. That's really the only healthy, safe, and respectful option that we have. Social distancing, wearing masks, avoiding gatherings of more than 5 people, delaying unnecessary travel. And I know this is going to become more difficult as we get into the holiday season and as the weather kind of closes in on us for the winter, but we really have to maintain that those protective measures. I know we're all sick of being at home. I'm sick of it. You're sick of it. We're all sick of it. But the real sickness is COVID. It's really a brutal disease. Dying by suffocation is a terrible, terrible death. So we can push our numbers back down. We've done it before. We can do it again. We just have to all work together and cooperate and think of our, again, families and friends and neighbors and our own health. So we can't ignore the pandemic. We've got to keep going. And thank you for your cooperation to date, and just encourage you all to be safe out there. So with that, I'll hand it over to Dr. Spitters from the Snohomish County Health District.
Well, thank you so much, Executive Summers, for really hitting the nail on the head. We're in a situation where we really need to redouble our efforts to achieve what we've achieved in the past. And just to support your comments in that direction, I'm with your and the audience's patience. I'm going to share my screen, just show a few slides here that really come from a publicly available, our weekly report that was posted yesterday. And so you should now be seeing a title slide, the COVID media availability. So next slide, I'm gonna get here. All right, so these are, you're seeing a series of vertical green bars. These just show the number of case reports received daily by the health district. And you can see we're in this third wave now with a spike last week that was higher than anything we saw in the second wave, and really competing with what we saw in the first wave. So this is real, it's sustained, and it's posing challenges for the community as well as for our control efforts. When we take those data and aggregate them together and calculate that rolling 2-week case rate, this is what Executive Summers was referring to. You know, we've gone, nearly vertical, very similar to that first wave. And we're now past where the second wave went, as I said earlier. And so, this is not going in a good direction, and we really need to do our best to do those things that we know. This is not a high-tech solution. It's really a behavioral one that we can all contribute to. Just to break things down a little bit further, this is this same curve, but broken out into age groups. And again, like we saw in the second wave, it's young adults. Yellow, that's 20 to 29. This gray line that's going up, that's 30 to 39. 40 to 49 in the blue, 50 to 59. So need I say more, young adults are at the core of this current activity as it was in the second phase. And again, I realize many of you young adults out there either have public facing jobs, essential work, maybe more reliance on public transportation and collective living. But we really, because of that, all the more reason we need everyone, but especially the folks affected, the young adults, to really focus in on avoiding gatherings, trying to just stick with what the things you have to do, and really trying to avoid other things. And I'll talk a little bit more about that in a moment. Fortunately, at the current time, the older age groups, especially those over age 70, have been spared. In between here are school-age children who've had a small bump going on. This is just a tabular depiction of what I just showed you, the current 2 weeks, the prior 2 weeks, and cumulatively in the 3 columns respectively. But moving from the middle column to the left, if you look at the increases over the rolling 2-week periods, 2/3 of the increase is occurring in individuals between 20 and 49 years of age. So again, that's, we're all in this together, but we really want that group to focus on, again, committing to reducing their risk of transmitting to others and being exposed, and protecting our older adults. Some spatial information here. These are the concentration of reported cases over the 2-week period from September 27 through October 10. That's the same reporting period that produced that 101 case rate. So again, as usual, mostly the cases are occurring where the people live, primarily most dense in the South Everett area, extending a little bit down, extending a little bit down the I-5 corridor, but there's, there are pockets of transmission occurring even outlying away from the more urban parts of the county. And when we look at rates, that's the number of cases per person living in a specific zip code. Again, we see the Everett, South Everett area most densely affected, but also Monroe, Sultan, and Marysville. And when you look at these colors, the dark blue is a rate greater than 90. The light blue is 60 to 89. And then the very light blue is above 30. So there's basically no area that's populated in the county that would be considered low transmission. That's, less than 25 cases per 100,000 per 2 weeks. So we're all living in moderate to high risk areas. Most of us are living in the high risk zone. So there's no part of the county that is immune from this. Now, again, our focus is on protecting acute care capacity for the care of COVID, as well as all other conditions. And over the long haul, here was our second wave. We had a little bump there, and things have been up and down, but pretty much flat through the beginning of this third wave. But if we look a little bit closer, these are just spread out over the last week and blown up. And you can see that the number of confirmed COVID cases in Snohomish County hospitals has increased from 20 to just under 30 over the last week. And we've also had an increase in the number of suspected cases that have testing pending, but it looks like they have COVID. So our hospitals are not being tested to the extent that their capacity to provide care is at risk, but the trajectory of these curves suggests that if they continue, we would be facing that within a few weeks. So all the more reason to really emphasize each and every one of our role in trying to prevent this from going further. And Executive Summers mentioned the number of deaths that's occurring nationally, and we are in that same boat. Things had really calmed down, and we were only having a death or two per week for quite a while, but we're again saw a little jump in deaths over the last 2-week period. And again, another signal that this is real and that unmitigated, it's going in a bad direction, and we could end up back where we were last March, both in terms of hospital capacity and then consequently the measures that would need to be taken to bring things back under control. So rather than doing that, my encouragement to all of us is, you know, I know the vast majority of people are committed and wearing face coverings and trying to limit their gatherings, but all of us are getting a little tired of this, as Executive Summers mentioned, and it's possible that even those who don't intend to be are letting their guard down a little bit, engaging in seemingly benign gatherings. That's what we're hearing from the case investigations, that you know, it's 5 to 10 people, maybe a family gathering, maybe some friends. And I really think, you know, you got to ratchet way back on that and kind of retreat your personal social life behavior back to what we were doing last spring voluntarily, so that hopefully we don't have to impose measures that would require that. A couple of other few things I'd like to emphasize: that airborne transmission, either by larger droplets that float for a few minutes or by tiny droplets that float for minutes to hours and can spread throughout a room. We're really starting to see science to suggest that is contributing significantly to transmission, which means that not only do we need to wear face coverings so that we don't generate those droplets, as I'm doing right now when I speak, or when we cough or sneeze, but even speaking and just breathing generates a cloud of those droplets, is we need to improve ventilation when we're indoors, especially if we're meeting with people who are not from our household, and then really try to move everything that you can that's social outdoors. And I think if you can't do that, you really ought to think twice about doing it, because you may get away with it, but as a population across the whole community, if we have that occurring again and again and again, we'll see transmission occurring, and that's what we're witnessing. Some other issues, people not thinking, well, I'm being safe at work, I'm wearing my face covering, I'm staying distance in my job role, and then I go sit down at the lunch table right next to other people, or ride to and from work with folks. You got to wear that face covering, roll the windows down, don't eat next to the people at the lunch table. We've got to all spread out and try to move outside as much as possible. And especially given the weather, that's not easy. So we're going to have to really dial back on what we pursue in terms of social contact to try to bend this curve. I just want to note, with respect for the faiths represented, we are having considerable difficulty with faith-based organizations meeting in group sizes without face coverings that are way in excess, way outside the boundaries of what is permitted. And we're having trouble in getting cooperation to encourage them to stop that. We've also had some resistance to contact investigations in those settings. So we encourage you, those who think likewise, to speak with your faith-based organization's leadership about efforts to try to control this, and think of the broad community, think of others. We want grandma and grandpa around for next year, even if we can't share the holidays with them this year. And then with our contact investigations, we're getting more resistance. People not calling back, or when they do call back, not being willing to share contacts. This is all managed confidentially, and it's a huge part of trying to stem transmission. So I really am pleading with all of you out there to try to place a little trust in the system that is aimed to protect us all. Last, I'm not going to go over this in detail. I think these slides will be made available by our team to you all, but there are resources out there for people who want to try to keep doing the right thing, but are facing social pressure to get together or have a gathering or do something that they think is either not in their personal health interest or is not in sync with the population-oriented measures that we're recommending. But it's sort of talking points for how to get through those difficult conversations. And the State Department of Health has put together a couple websites, and we'll provide you with those. Thanks to Heather Thomas, our communications lead, for putting these slides together. And I'll turn it back over to you, Executive Summers.
Thank you, Doctor. Here we go. So first question, since it appears to be small gatherings as the main cause, are the restaurants and stores doing a good job of prevention? And that means that there really is no need for further restriction at those locations. So are they doing a good job?
In our interactions with them, and in my, I go get takeout food once in a while too, and I think the vast majority of food service enterprises are doing a great job of trying to protect their staff and the clientele. But a reality is that, given the potential for droplets, large and small droplets that float in the air. And, when you're dining in and eating, there is additional risk, I think, associated with that rather than takeout. I'd like to be able to say otherwise, but just the facts are what they are. That's the science. And so, especially those who are vulnerable, underlying medical conditions, older, adults, really ought to think twice about dining in or dining anywhere because there's no face covering. So everybody, especially, you're talking and there's a big cloud of droplets that if somebody's got it could spread things around. So I think the restaurants are doing a good job, but we have to think twice about our willingness to sit in groups without face coverings.
So any advice for Halloween or trick-or-treating?
I'm off the hook a little bit because my kids are grown, but this is a tough question, but this is the entree to what's a forthcoming holiday season, and the extent to which we can forego pleasure now to bend the curve and have help keep kids in school, help the businesses that are trying to get through and employ people and serve people. I think it's all in that interest for us to try to defer any forms of elective gathering until a future date when it's safer. And so, I'm discouraging trick-or-treating. And we've put out some alternatives. Feel free to look at our website for that. And I know the state health department has done the same, but I feel it'd be irresponsible for me to say otherwise. I'd say keep your kids home at Halloween.
Doctor, another question for you. What specifically are you seeing in the way of resistance from faith-based groups? Specifically, what has your staff experienced?
Well, reticence to share contact lists, names of people that might have been exposed, and then also, after either being notified or becoming aware that there are larger gatherings than permitted, or that face coverings and physical distancing aren't being employed in those settings, and then giving feedback about that and guidance, not seeing too much change. And so that's concerning that those are the kind of things that can create a super spreader event. And all, on the investigation, and all entities, individuals, businesses, what have you, are compelled by law to cooperate with public health authorities during investigations. So we find this troubling in terms of completing our work, and a little bit frustrating in terms of not getting a fully cooperative spirit for the whole community's benefit.
So I guess following on that, there's a follow-up question about what can the health district in the county do to force faith-based organizations to comply with COVID restrictions. And I'll just say we just try to provide the absolute best information we can, be very honest and clear about the risks involved and the actions that can be taken to protect everybody, and appeal to everybody's concern, not only for their own health, but the health of those around them. And, in the churches that I'm familiar with locally, restrictions are in place in terms of attendance and seating and no singing. And so a lot of faith-based groups are doing a great job and trying. I know there's some outliers, but at the end of the day, people are going to have to take this in their own hands. And that's my opinion. Doctor, do you want to add on to that?
Everything you just said, I would only repeat it. That I think the majority, these are a few scenarios that we are seeing around the county. They're troublesome to us because they're what's on our plate, but we're not hearing problems associated with the vast majority of faith-based organizations, which we assume that means they're doing it the right way. And I think education, encouragement, trying to be supportive and maintain a relationship is much more productive than us getting in adversarial relationships with entities. I don't think that's going to get us any closer to where we want to go.
So going back, we're now well out of the moderate risk category for schools. Doctor, is your guidance to districts changing?
Well, that's a correct assessment that the framework for schools defines a rate greater than 75 as high risk. That still leaves open windows for specific populations to engage in-person learning. And as usual, we have a weekly meeting with, or a bi-weekly meeting. Every 2 weeks we meet with the school superintendents and administrators, and we'll be doing that again and discussing these very matters and how the current situation and the framework, where does that put us in terms of in-person learning. But that's a discussion we, the health district, needs to have with them before we go further.
So this is a follow-up to that. Last week, you asked schools to pause any further reopening plans, but several, including Everett, are moving forward with plans that were already in the works as per your guidance. Are you rethinking that?
Well, that's same answer, slightly different question, but yes, schools is an issue. We want to make sure that children have access to learning and that it's done safely, and that the staff also are able to do their job and be safe, and that we are following state guidance. But the details of that really is a discussion for us to have with the school districts before we respectfully, before we have it with the media.
Okay. Can you put the county's test positivity rate into context? It's relatively close to its target despite the spiking case rate. Also, can you remind folks why it's so important to keep hospitals under capacity and what happens to treatment fatalities if our hospitals surge?
Certainly. So on the case rate, on the test positivity rate countywide, when things have been at their best, we've been down in the low, 2.2 or so, 2.5%. The goal is less than 2%, but we've been in the ballpark. But now I think we're on our 4th consecutive week of increase, taking us up to 4.6% positive countywide in the last week measured. So that's moving up above, another sort of index of heightened concern is when your positivity rate goes above 5. So I think that's actually in parallel with what we're seeing. They're not dissociated. Positivity rate and overall case report rates are sadly both headed up. And just to circle back around to the hospital and acute care capacity item that Executive Summers alluded to in his remarks, we've got, I think it's 800-900 acute care beds in the county, and right now about 80% of them are occupied. If you start filling them up with COVID patients, that puts a pressure on the system to provide care to those individuals, consumes lots of personal protective equipment. And then as things escalate, you start to have other equipment problems like ventilators or just beds for people who have an appendicitis or a heart attack or a stroke, or who needed to have that biopsy of their lung to see if that nodule is cancer or something else. And so all those other things get sort of triaged and put to the side, as we were doing last spring. So those are the things we're trying to avoid, in addition, of course, to just the suffering and death that accompanies those hospitalizations.
So the last question we have in chat box, and I'd like to address it also. What would you say to those who remain critical of this type of message and point to the 20 to 49-year-olds not getting sick or dying, who wonder why they should care about this? And I just want to say that, you know, there's an old quote that says, "No man is an island." Rather famous, but none of us live in bubbles. We are affected by those around us, and we affect those around us that we come in contact with. And you know, often that's family or friends or co-workers. And the way these diseases work is they're transmitted from person to person. And so you really can't isolate yourself or think of any group as being isolated. When we have family gatherings before COVID, we had all age groups there, and younger folks that may not get as sick or die as frequently as the at-risk groups are still carriers and can affect the rest of us. And these waves really are transmitted, as you saw, a number of age groups are going up and track each other. So, and also this is resulting in the isolation of older folks. I mean, we've had to really take those more susceptible populations and isolate them, and that's got its own consequences. I've got a 90-plus-year-old mother-in-law who doesn't get out and is feeling isolated, and it's terrible. So we just need to get the disease under control, hope for a vaccine, and that we can get beyond this. But it's going to take some time, and everybody's got to cooperate and realize we're all really in this together. We keep saying that, but that is the truth of it. Doctor?
I honestly can't improve on that. I'll just add a couple of emphasizing points. That one, young people don't die or get hospitalized at the same rate as older adults, but they are still getting hospitalized, and there are still deaths in younger age groups. And science is starting to show that, you know, 3 months down the line, many people who have had COVID still have residual fatigue, difficulty breathing in particular. Those two things lag on a long time, so that impacts quality of life and productivity, regardless of age down the line. And I think it's slim reassurance that currently things are confined to younger age groups. As Executive Summers said, you know, ultimately it will find its way into older age groups if we don't get this under control soon. And so I think all the more reason, as Executive Summers said, you know, we got to sort of think of ourselves as the community in this respect, and then behave in a way that protects the community and not focus in on our own single individual interests.
So now we've got two more and then we'll wrap it up. But with the increases in rates and positive tests, we're not seeing the county toughen any restrictions. The message is the same as it has been all along. Why? And, you know, actually, I'll say when the first set of restrictions went into place, we did see a response. We saw that first peak and we saw a response, and we actually got under the 25 new cases per 100,000 threshold that had been sent. So we had some real success with that. And the restrictions on restaurants and gatherings and all sorts of things that have been in place have had an effect. And the second wave, I think, really was around some holidays and other events that are very hard to control. I mean, the restrictions have been in place that really should have prevented this, but family gatherings, for example, just the loosening up of people's concern and deciding to, you know, get together with other folks, that's what's driving it now. And that's extremely difficult, if not impossible, to control in our society anyway. We don't have the tools to really prohibit people from leaving their homes and visiting each other. And I don't see that that's a possibility. But with this next peak or this next spike, we'll just have to see what happens, and we'll be working with other counties and the state to see if we do need to try to impose some more severe recommendations or restrictions. Doctor, you have any thoughts on that?
I agree completely. And in the interim, this is our chance as a community to try to bend the curve and not have to resort to blunter instruments that have effects on parts of the public life and the economy that may not even be contributing to what's going on. So, let's do what we can with what's in our hands. And yeah, I fully support your perspective on that.
Yeah, the last question was just really, is the county health district expecting any new guidance or rules from the state? And we both the county and the health district are talking with the state and our state counterparts all the time, and am aware that the state has sort of been rethinking its strategy, whether kind of the current system should remain in place, and they've tended towards more of a activity-based or situational-based types of restrictions, trying to nuance this to really respond to the risk that a particular, whether it's restaurants or bars or movie theaters or construction sites or manufacturing plants, and trying to be more sensitive to the actual conditions there and the issues. And I think that will probably continue. I'm not aware of any new rules or anything that are imminent coming out of the state. And I don't know, Doctor, if you've heard anything elsewhere from your counterparts.
I have the same window that you do. There are discussions going on considering, what's the best framework going forward, but nothing, no fruit of that discussion at this time.
Just one last thing. We are still expecting everything that I'm aware of, that widespread distribution or availability of a vaccine, should one become available, probably is not likely to the general population till spring or next summer, really. There could be some early releases that will get out first to first responders and the most vulnerable, but it's going to be a while yet. And we do have plans in place at the county level that we've developed with the health district to distribute vaccines when it's available. So our team's been working hard on that. And so we're prepared for an efficient and quick distribution when that becomes available, but it's still a ways off. Okay, I think that's it.
This is Kristen in the Joint Information Center. Thank you again for joining us today and for all of your questions. We're going to go ahead and wrap up. Please stay tuned for future media availabilities.
Thank you. Thank you, Doctor.
Thank you, Executive Summers.